In a few couple of minutes, I'll be bringing up the guest speaker today, which is Stellababy. Yeah, I can see her joining the hall right now. Stellababy, you're welcome. That's our keynote speaker for tonight. She's going to really explain how to apply JIGSIMUR on all ailments, if not all ailments, on about 20, 30 ailments that time will permit us to talk about tonight. All right. So while she's giving us this information, please, I don't want you to just rely on this particular webinar alone. Get your writing material, get your notepad, put something down, ensure you pen something down. Make sure that you can revisit the information over and over again. When you have a lot of information, then it will make your prospects and your downlines, your customers build trust and confidence in you. The level of trust and confidence they will build in you will be stronger than when you have no information. See, may I chip in this particular lies that some of our distributors have been in this business for 2 years, 3 years, yet when a customer asks a question, they run to the group to go and ask. They run to treatment group to go and ask. This simply tells us that we are not learning. We are not learning what we are supposed to learn, okay? If we are really learning what we are supposed to learn, a year, 2 years in the business, you shouldn't be, you shouldn't rely on your upline or your group or whatever for information on how to treat fibroid, how to treat hepatitis, how to treat hemorrhoids, infertility, arthritis, and all. Some of our distributors, we ask you some questions that you and I know that what they are asking is just to use the general treatment plan of JIGSIMUR on several ailments, but they will still come to you to ask you, hey, please, how do I treat arthritis? Some distributors will even come to ask. You have been repeating this over and over and over and over. Some of our downlines, our registered members will still come to ask you, please, how many bottles will be required to treat diabetes? How many bottles is required to treat prostate cancer? How many bottles is required to treat cancer? And you as a team leader, you have been repeating this on the group. In short, they have their own group that they added you. You answer questions. They have seen people ask the same question and you have answered it. Yet, they will still come back to your group to ask, please, how many bottles do I need to treat cancer? Or some people will even forward the question that was thrown at them. They would have forwarded it to the group. And you'll be like, oh, and this person is building a team. What particular team are you building when you don't have information to disseminate?
And don't hang.
Hello, is anybody here?
No.
Can you hear me? Hello, can you hear me?
Yeah, I can hear you.
Okay.
We are hearing you, but network is bad.
We are hearing you.
Network is breaking down.
From his
We
own
can
side.
hear you.
Yeah, from your side.
From his own side.
Okay.
We can hear you, ma'am.
Okay. My name is Stella, Ebuzium Stella, and I'm popularly known as Stellababy in JIGSIMUR business. I know our anchorman will soon be back here, but while we are waiting his comeback, I will say something about using JIGSIMUR treatment. I'll first of all give general rules, what JIGSIMUR does and how it does it.
What's my mic?
JIGSIMUR is not a particular treatment for any ailment. Hello, can you hear me?
Yes.
Yeah, we can hear you.
Okay. JIGSIMUR as a drink or as a drug is not a treatment for any particular ailment. JIGSIMUR is an alkaline drink, an alkaline herbal drink. And the way it takes care of ailments is when we fall sick, it's as a result of decay in any part of our body or on a special organ that affects the body's performance. Now, I will give you an example. Diabetes. So, somebody suffering from diabetes, after a long while, will have blood vision. He or she cannot see well. After some time, he or she will not be able to walk well. It will also affect the ear. So you can see that the actual cause of diabetes, the actual cause of the blood vision or not able to walk well is diabetes. And the actual cause of diabetes is the ability of the body not to break down sugar. So in using JIGSIMUR as a treatment, it does not go into your body and say, this person said he has arthritis, let me go and treat arthritis. No.
Exactly what I used to tell my customer.
Can you hear me? Somebody is talking.
Yes, we can hear you.
Okay. JIGSIMUR goes into the body as a neutralizer. As the body as a neutralizer, what it actually does is stop the decay of any of the organs or all of the organs that is decaying. Our body is built to heal itself. The moment the decay stops, the body heals itself. Now, for special cases where we need a thorough touch, there are special cases where there are thorough touches to be done. Those thorough touches, not as if it's just because it's tougher to stop the decay of that organism, of that part of the body. You need a special touch to get that decay to stop.
I am waiting for more both. I don't tell me about this man.
Hello, and I can hear them.
Mute other people now while the meeting is on.
You know, I'm not the one that anchored it. I can't move from my place. I can't. Okay, let me try. I can't.
Please continue.
Uncle Taiwo, are you here now?
Yes, I am. I'm trying to mute those that are disturbing.
Okay. So when it comes into the body, it stops the decay of the body organs. And when the body organs stop decaying, since our body is built to rebuild itself, these organs begin to rebuild itself. That is when you see the person that has diabetes will still tell you that I have high sugar, but my blood vision has stopped. The blood vision did not stop because the diabetes is gone. It's because the part that affected the blood vision has started rebuilding itself. And up till the last minute, when all other organs are built, some of the ailments will still be there. That you have headache does not say you don't really have just headache. Something caused headache. And JIGSIMUR enters your body to find that thing that caused the headache and begin to rebuild it, begin to help you rebuild it. So I'll start from the head, from the hair. If you have your hair falling off, as you take your 15 ml JIGSIMUR, you also rub JIGSIMUR on the hair. After some time, the hair will stop falling. Hair. If you have skin issue on the head, same as your rubbing, that skin issue will go. You have to take JIGSIMUR orally and rub on the affected part. Reason is that while it's taking care from the inside, that part affected outside needs also a special touch. Somebody that has cataracts, growth in the eye, you do JIGSIMUR 50-50 water while you're taking it orally. You also mix JIGSIMUR 50% water, 50% JIGSIMUR. Drop it on your eye. Please, when you're taking 50% JIGSIMUR, don't shake the bottle. Remember, JIGSIMUR has some particles in it, and our eyes has a way of reacting to any fiber. No matter how small it is, the eye reacts to it. So don't shake. Just turn JIGSIMUR and turn clean water. Please remember to wash the eye drop container very, very well, so that you don't mix JIGSIMUR with another chemical that was in that eye drop container. Wash very well, rinse very well before putting JIGSIMUR and water. Then the nose, you also drop in the nose. If there is boil, if there is any pain, if there is anything on the nose, drop JIGSIMUR on the nose. Same thing as the ear. Most times, one of the problems we have with the ear affects the throat also. That is why you hear about ear, nose, throat doctors. When you're taking orally, you also drop so that there'll be a direct contact between the JIGSIMUR and wherever the issue is. Same thing as the teeth. Drop JIGSIMUR 100% on whichever teeth is aching you. If there is a hole, pour JIGSIMUR directly on that hole. Squash your mouth, pour out the JIGSIMUR. You find out that your head will come cool because the maggot that is eating up the teeth will come out the moment you pour JIGSIMUR 100% to it. And you start taking, you take orally also, and do that every morning until the pain and the gum heals itself. Then if you have goiter, before I'll tell you how to take JIGSIMUR orally. If you're taking JIGSIMUR orally, your body mass is very, very important. If you're the fat people like me, don't say because the slim people are taking 15 mils, you will take 15 mils. Because you know, as we are fat, our body is resistant to so many things. I want to use alcohol as an example. If you see a fat person that drank and is drunk, that means that quantity of alcohol that he or she took, if a slim person takes it, that person won't be able to stand up. Because we have fat lining that doesn't allow things penetrate our body that easy. So that we are giving 15 mils is not for people my size. 30 mils is ideal for fat people, but the person is slim. Let him or her take 15 mils. If you allow her to take 30 mils, this is where you start hearing, I'm losing so much weight. But with us, you won't even know. We'll lose weight, but you won't even know. So when you take early in the morning, drink warm water. If you have lemon, put lemon. That will also alkalize your body. That will help in alkalizing the body. Then after 20 minutes, take JIGSIMUR, 15 mils or 30 mils, whichever way. That is a start. If there's any part of the body that is swollen up, massage that part of the body with natural oils, coconut oil, kernel oil, shea butter. After massaging with those oils, that is to enable the body, the hand move freely on the swollen part. Clean and rub JIGSIMUR. Clean the oil off, then rub JIGSIMUR on that part. If there is any part like you have foot rot or something, wash with warm water and salt, then rub JIGSIMUR on that leg. The most sores you see, diabetic sores, wash with warm water with salt. The reason you put salt into warm water to wash is so as to kill off all the maggots living there. If you use only JIGSIMUR to wash, the pain you might not be able to wash out thoroughly. But when you use warm water penetrates easily into anything, into wound, into any skin, and it will bring out the maggots that are there. Then as you are treating with JIGSIMUR, the wounds begin to dry. If you don't wash out the maggot, you will know, because as you're dressing with JIGSIMUR, the parts where the maggots are not around will dry off. But wherever the maggot is, will be soaking wet all the time. So when you wash and dress with JIGSIMUR, please don't use plaster, use wire gauze to allow in air in and out of the wound. If you have a patient that says, sorry, I have cancer, I'm feeling cancer. The cancer is I've already done surgery. There is a wound that is already coming out. Don't be scared. Allow the patient to take 30 mils of JIGSIMUR. Then please don't use the same bottle you're putting your hand to rub on your body. Don't drink it. JIGSIMUR is a very strong herb. If you turn JIGSIMUR into a rubber bottle, the efficiency reduces. That's to tell you how strong herb it is. That one the person is rubbing. It's not the same bottle. It's not from the same bottle he or she will be drinking, except you're going to be turning out of the bottle to rub. And if the person is rubbing JIGSIMUR because he or she has breast cancer, don't just rub in the breast. Rub all over. I advise you rub all over the tummy region, all over the chest region to your back, because JIGSIMUR will help us collect all the cancerous cells. What they use chemotherapy to do is to kill the cancerous cells. But JIGSIMUR will push them together. The person will tell you, I have a lump in my breast now, or there is this lump I'm feeling under my armpit. Don't tell the person not to worry. Keep rubbing JIGSIMUR. Those lumps will all gather together and burst open and begin to bring out pus. That pus you are seeing is not just pus. It's the cancerous cells coming out. Make sure that while that thing is coming out, the person continues rubbing. And if you're using JIGSIMUR as a treatment, please don't just stop halfway and say, my drug's finished, let's wait 3 days after. No. Most of these ailments, when you push them back and stop, they will push you further 10 kilometers from where they are coming from, especially cases like cancer and fibroid. Prostrate, cancer, prostrate falls into cancer. The moment you stop medication, they double grow. The infection also double grows. But if you continue back to back as the drug is finishing, let the person, if you're prescribing for somebody and the person bought a bottle, I would tell the person, this bottle is going to last you for 12 days. On the 10th day, I've started calling the person. Remember, if your drug finishes, you are starting afresh. Because if you take one bottle of JIGSIMUR and get detoxified and wait to get another money to buy another bottle, the next bottle you buy after 3 days, you begin detoxification afresh. Because you are being detoxified, not because of just, they just need to detoxify you. From the water we drink, the air we breathe, the life we are living, everything comes into us. And it's only if we do constant detoxification that we can start getting results of the treatment we are doing fast. Where did I get to? Somebody has prostate cancer, that's a man, or a woman has infection. While the man that is taking orally and also the woman is taking orally, there's what they call panty liner. You can dab the panty liner. There's a blue line in the middle. Put JIGSIMUR on that panty liner. Panty liner is not meant for men nor women or woman. Panty liner is meant to be used to touch whatever part that is affected under. If there is wound on the private under, you will not go there and begin to put plaster. It's panty liner you will use. So as if somebody has prostrate, whether very big or very small, after taking JIGSIMUR orally, let him or her put panty liner in. Let him or her put panty liner, wear panty liner in his boxers, so that the soaked panty liner, the JIGSIMUR soaked in panty liner, will touch the prostrate, the enlargement. For a woman that has infection, it will also help you drag whichever one is at the vaginal part will start coming out. For those that have blocked fallopian tube, it also helps them. In fact, even those that have ceased menstruation, you know something blocked it, that is why it's not coming out. While JIGSIMUR is trying to push it from the up, JIGSIMUR on the panty liner will also want to drag whatever is on the surface of the vagina out. And that is how infections block fallopian tube, prostrate cancer. You know, prostrate cancer has a swell. So that swell has to be touching JIGSIMUR to be drying off. People that have mumps also, they rub JIGSIMUR on their cheek. Rough, 100% JIGSIMUR, morning and night. Whichever treatment you're doing with JIGSIMUR, you do it twice, morning and night. Morning before you go out, night after you come back. Hello, am I cut off? You can hear me? Okay.
Yes, we can.
Okay. Okay. If you are treating wound, you also dress with JIGSIMUR and cover with wire gauze. Somebody looking for fruit of the womb, male or female, you also take JIGSIMUR twice daily and also add fruits and vegetables. People looking for fruit of the womb, most times it is advisable to eat roots, food that comes from the roots, as in you eat yam, you eat carrots, roots, mostly roots. They help in fertility. Then do plenty of vegetable. Abstain from foods that has preservatives. Most of our foods, especially me, I say stay away from bread. Because if you're to eat bread, you're supposed to eat homemade. There is no homemade bread. Even agege bread that is supposed to be homemade is no longer homemade. So it's better to avoid it. Avoid food with high cholesterol. Do more of vegetables. If you're able to stay away from plenty of oil, please do. That will be good for you. I think I've gone through the whole ailments if you are diabetic, same take orally. If there is a wound, treat the sore. I think I've gone through all the ailments. For those that has pile, after taking orally, when the person goes to toilet, there's a protrusion. Take a bottle that has a sprayer, or if you have hanky or cotton wool that is very clean, that when you shake it, it does not drop those white particles. Soak in JIGSIMUR. After washing the ass, use that JIGSIMUR soap cotton wool and dab the anus, dab the protruding area. Gradually, you see that pile withdrawing back. Continue like that until the elasticity of the large intestine turns back. But remember to always take orally, no matter the treatment you're taking. Try your best to take JIGSIMUR orally. Is there any ailment that I've not talked about? My uncle, please help me.
Cancer of the pocket. Cancer of the pocket.
Cancer of the pocket. Okay,
Yes.
cancer of the pocket will not be taken today. It will be taken some other time, because that's the most serious ailment that anybody can face. Some other time we'll take care of cancer of the pocket.
Ndo.
Boss, please talk about asthma, treatment of asthma.
Asthma treatment is the same we take orally. And please, the asthma patient, anything that has to do with cold, cough, you don't tell me I cannot take lemon. You must have to take lemons and oranges. They are heavy vitamins C top. And those cold ailments really need vitamin C to come back to life. Take orally, take one water first thing in the morning, take JIGSIMUR 20 minutes after, and you're good to go. Then I want to talk about something. Somebody tells you I am sick, I want to treat something. Don't go about telling the person that 1 bottle, 2 bottles will do it. Even the medical doctor has not been able to tell us how many Panadol can take care of your headache. They only say if symptoms persist after 3 days, consult your doctor. And JIGSIMUR says if symptoms persist after 3 months, come back, let's know. So don't tell somebody that by the time you take 1 or 2 bottles, you'll be free. 1 bottle is for detoxification. The second bottle starts treatment. Some people are very lucky that the moment they start taking this, I've seen somebody I treated for fibroid, even though she did not know she had fibroid. But it took less than 2.5 bottles. If somebody is telling you that I have fibroid, how many bottles? Your response to that to make the person buy one bottle and say, I took one bottle of JIGSIMUR, I have not been able to treat fibroid. Fibroid is a very, very difficult sickness. It's not something that you wake up in the morning and start counting bottles that you are supposed to use. Fibroid for a fibroid patient is a specialty ailment. Wake up in the morning, 24 hours, no food, no oil, do vegetables and fruits, do them very well. Keep drinking warm water for the day until your tract is clean. Then please, I don't advise a fibroid patient to start with 15 ml. Let them take 30 ml. Let them, because fibroid needs a push. Some of them can be very, very stubborn. So it's when you push them, fibroid is like worm. Something that they will do surgery for it to regrow. That's to tell you that it's actually a worm. So when it really needs a hard push and a constant push. So most times, if people are treating fibroid, I recommend 30 mils, and that is what has been giving me my better results on fibroid. The person should do 30 mils. If the person can do it 3 times, fine. But if you can't, because 3 times is not a child's play, it's going to shake you. It's going to tell you that you're doing something. 2 times, okay. 30 mils in the morning, 30 mils in the night. No mixing. Stay away from frozen food. Those frozen food, they all have preservatives, except fishes that have scale. Try your best to stay away from tinned foods like tomatoes, tinned milk. Most of them have preservatives. And if you're taking JIGSIMUR for treatment, for adequate results, check the meals you are not supposed to take. Stay away from them, because you are taking care of an ailment. Let's assume you're taking care of sugar. In the morning, you wake up, you drink 5 cubes of sugar. JIGSIMUR will try to remove the 5 that you have just. JIGSIMUR will try to remove the 5 that you have just added. The other 5 that is there that it wants to remove, it will now say, okay, later we'll remove that one. And tomorrow again, you go and it will now only be attending to the present thing you are doing and leave the other things that it's supposed to go and do. So while you're taking treatment, find out all the meals you don't eat. Hello, can you hear me?
I can hear you. I want to ask you a
Yes,
question,
we
please.
can hear you.
Okay.
We can hear you.
Okay, somebody wants to ask a question.
Please, let me quickly address that. Please, once she's done, if you have a question, just raise a hand. Raise a hand, you see the emoji on your screen. Raise a hand so we know how to attend to questions one after the other. Thank you.
Okay, thank you. So while taking treatment, you don't need to go back to those habits that you are not supposed to do while taking treatment. You cannot be chasing something and bringing more back. It becomes a job that you stay a very long time to get results. Thank you.
Thank you so much, Stellababy. That's a perfect and wonderful presentation. More grace to your elbow. We have people who have questions. Okay, let me start with those who raise their hand. Some persons have already dropped their question in the chat box. I'm going to read them out if they have not asked that question by raising their hand. Mr. Lawal Mohammed, please, can you unmute yourself and ask your question, sir?
Okay, thank you for the wonderful presentation today. Can you hear me?
Yes.
Yeah, I can hear you.
Okay, and my question is that my patient has been using JIGSIMUR. It was last year, I think, and he had finished only 1 bottle of JIGSIMUR. He is treating HIV and AIDS.
Can we know where you are speaking from?
I am speaking from Sokoto State. So he finished a bottle, and after that he stopped using JIGSIMUR. It is now become apparent that he has to come back to the JIGSIMUR treatment again. So I don't know, is it going to be effective in the treatment of his ailment, or I don't know if the HIV has developed a kind of resistance if it is possible that there will be a resistance to the treatment. That's question number one.
Okay.
Yes.
Because he stopped a long time ago, you know, it's going to start again. Whichever resistance that was due along the line would have dropped by now, because the only thing we have to know is that when he or she dropped JIGSIMUR, what happened? How has he been managing the ailment? If he has been on other drugs, let's know the drugs.
Yes, he has been on ARV drugs. That was the only reason. Yes.
Okay, I want to say something. If somebody tells that he's in ARV drug, ARV is not a drug. ARV is just like somebody having sex and wearing condom. ARV is just so that you are not able to transfer to another person. That's what ARV is. Antiviral drug. Just that he or she will not be able to transfer to the next person. So that is not drug. He or she has to start. That's full, that he has AIDS. And for AIDS patient, I say 30 mils. He also has to start with the water. If he cannot get lemon, he should buy apple cider vinegar. Apple cider, he needs the lemon. He needs the lemon seriously.
What is the quantity of the apple cider vinegar, please?
Just a cup of
morning.
apple in warm water.
In warm water.
Yes,
Okay.
you take it early in the morning, and also take more. You should not stop the AVR. AVR is not a drug.
Okay, he should not stop using the antiretroviral drugs.
Yes, it's just for him not to pass it to the next person. And he should not drop until he has confirmed himself negative.
Okay,
he has confirmed his viral load. If he can, let him check his viral load. While he's on JIGSIMUR, after 2 months, let him go and check the viral load.
I missed that.
Yes.
Sorry, I missed that, Auntie, please. About the viral load, if you can have a viral load test, what do you suggest he should do?
If he go and gets his viral load test, he knows his load. As he's taking JIGSIMUR after 2 months, he looks at the load again. Is it coming down or is it going up? If we look at the load, it's not coming down reasonably. We increase the quantity of JIGSIMUR is taking. If it's coming down, then it remains like that and continue until it comes.
Okay.
Yes.
Okay, thank you very much for.
Tell him that he shouldn't stop.
Okay.
Yeah. Well
thank
done.
you.
Is that all of your questions?
Yes, for now, that is all. Thank you.
You're welcome.
Yeah.
Adela Kojo. Are you sleeping? Any other question?
Hello, ma.
Yeah. I'm listening.
Thanks for your lesson. I treated somebody with fibroid. After taking the JIGSIMUR for 6 months, she went for text, and the fibroid, they said, is even increased. It has not reduced at all.
Okay. I won't believe that somebody took JIGSIMUR to treat fibroid for 6 months. The question is, has the person been on JIGSIMUR medication, or does he or she take JIGSIMUR at will? Because the highest I've done treatment of fibroid is 4 months. Fibroid, like I said before, fibroid is a difficult ailment. It's not something that you take and you stop. If you take and stop, it returns back. Look at when you ask them, when they do surgery in the hospital, it grows back.
Yes.
They tell you how strong it is. So if the person has actually been on medication, how many bottles did the person use? I'll tell you whether it's true or lie. How many bottles did the person use in 6 months?
The person you, I think she took more than 4 cartons. Oh. That's about,
Father, I know what is 4 cartons.
48 bottles.
I mean, that's that's 4 times when it is 4 and you have 4 big bottles and one small.
Okay, 16 bottles. Madam, she did not take it accurately.
For 1
bottle of JIGSIMUR for a
treatment of fibroid.
1 bottle of JIGSIMUR for a fibroid patient lasts for 12 days.
So it will not be enough, sir.
That's for 48. This, I'm just saying the average, that's for a slim person that has fibroid. But for the average Nigerian that has fibroid, he has weight. So you do 60 meals per day. 60 meals divided by 750. You know what you're doing, just 10 days. So for him to do 6 months, she did not take the drugs accurately. She did not. And she did not do the hot water therapy. And she did not also stay away, because the moment you stay, you are taking treatment for fibroid. You must be serious with your abstainism. You must abstain from alcohol. You must abstain from chewing gum. You must abstain from Milo.
Bread, anything that made with fraud.
Okay, I'm hearing
anything that was made with fraud. That is bread, all this thing. It grows.
You don't need any sort of biscuits, flour, nothing. So if she did her total abstinence, the fibroid will drop. Yeah, I've never done 6 months and it comes down.
Okay.
I don't know. Can I add something on that?
Yes.
Okay, please go ahead.
No.
Please
go
ahead.
You know, some people there we create. I have a distributor that called me. Why is it that this one don't work on fibroid? That this one I've been taking it for like 1 year. Nothing happened. I was like, how come? And I asked her to give me the number of the woman. The woman, she claimed that I have taken it for 1 year, bought just a pack. And inside that pack, she have not finished using 1 bottle. And she's expecting miracle. Do you understand? Yeah. So some people, if I'm the one treating fibroid, I will tell you, 1, be ready to spend. You will consume JIGSIMUR, because I will ask you, you apply what you call seed bed. Before you bathe, hot water, you pour JIGSIMUR and sit for some time there. You use it on pad. If I'm treating fibroid, you will not be able to use 1 bottle for 1 week, because you make sure you get results. The problem is that Nigeria, they always look for so many excuses to tell you it's not working because it's online. If you not obey your instruction, there is no how you can get results. And another thing I want us to add, like if you are treating some cancer or asthma, you need to ask questions. Don't be so fast. Someone want to order without asking, what is your medical result, or how far have you gone treatment? How many years do you have any other underlying ailment? How long have you been this? It will help you. And also you ask, is there any history in the family? Like my family, some people take it for treatment, while some take it for preventive. If someone that have asthma is in the genetic, you have to ask the person. Make sure that every member of your family, even when they have it or not, they take JIGSIMUR. So sometimes we don't get results because we don't ask questions. We are someone that want, if you want to HIV or fibroid or cancer, you want to buy 1 bottle, I will not sell for you, because it's not treatment. So when you ask them questions, you will know the actuality. Some of them, they will lie a lot. Like this one that said, what it means that it's just 1 pack. Imagine someone that is treating fibroid, use 1 pack for
6 months.
How do you get results? It's not possible. If I'm treating you fibroid, after 1 month, I still have it. Tell me, you still have 3 bottles. I will tell you, madam, when you are ready for treatment, come back again. You are not doing
liner. You need to soak your pad with JIGSIMUR.
Yes.
Orally, 1 bottle stays for 12 days. Then what of the ones you're using to line your pants? And you can't tell me
And
that
the one in hot water.
milk, no spill. There must be spillage. So there is no way you use 4 bottles in 48 days. It's not possible. So that person that is saying that he has been on JIGSIMUR for 6 months, I don't believe. I've never done 3 months with JIGSIMUR fibroid. Never.
All right, thank you, bosses. Stellababy and Chiva 001, please. Can we take the next question from Mr. Obi Emmanuel Amechi? Mr. Obi Emmanuel Amechi. Obi Emmanuel Amechi. Obi Emmanuel, please unmute yourself. Obi Emmanuel Amechi.
Hello, are you hearing me?
Yes, sir.
Yes, we can hear you.
Okay, good evening, ma'am.
I will encourage everybody to put up our videos, except you are in the restroom, so we can put faces to our names.
Okay, let me.
Mr.
Are you
Obi,
hearing me?
go
Yeah,
ahead.
are you hearing me? Okay, please, this is me. Rheumatism and all those waist pains are my problems. I've taken just more for 3 bottles for now. So, but I'm still getting some little sharp pain at my waist. So, I want to find, can I still continue or I should hold on a bit?
Okay. JIGSIMUR has no overdose.
Okay.
And it has no side effects.
Okay.
You can use JIGSIMUR for maintenance or for treatment.
I say for treatment. For
yes,
treatment.
I'm telling you, you can use it for maintenance or for treatment, whichever way.
Okay.
So asking you to stop JIGSIMUR makes no sense. Now you're treating with, are you a tall person?
Yes.
Okay. Now, most times, after taking drug and you find out that the pains are gone, there is a sharp pain. It has to do with posture correction. Because most of us that are tall, we actually does not, our postures, we don't allow it to stay correct. So now that the pains are actually gone, it's just that small sharp one that is on the waist, there is posture defection with you. What you now do is in the night when you want to sleep, put pillow by your back. Let your waist touch down and let your head touch down. Stay like that for 30 minutes.
Okay.
Repeating. The first day you will try it, you hear a snap. You hear something like snap, proo, proo, proo. That is the bone turning to the original position it should be. There are machines, there is something you can use for that, but you can use your pillow. While you're using it, you are taking JIGSIMUR. If you continue after some time, when the bones are back in place, that particular one sharp one will be out.
All right. Because it's as if the spinal cord is shifting.
Yes, that's what I'm telling you. That is our height. It is the height. Because of our height, we don't really move that tall. We don't stand straight. You hardly see a tall person that is standing very straight. He or she would, especially if you're moving with people that are not as tall as you are, you see yourself trying to make sure that you are not looking too tall unknowingly. And then remember that the gravity, you that is tall, that is standing, same gravity you are on, the same thing with the short person, same thing with the fat person. And we now, from childhood, we are not taught on how to correct our postures. It is when we start aging that those things begin to play out. So if you can, put a pillow and sleep. But there is something you can use. I have that, we call it back stretcher. You just put it, and when you're, even you will know that, yes, this bone, something is happening.
The
if you have that back stretcher. Yeah.
How much does it cost?
I bought it a long time ago. Now it's just 10,000 then.
It's not money. That is not much anyway.
I don't know whether how much they are selling it now.
And to get it now, I'm in worry. I know my upline will do. Lady you, if she know about it, I can meet her if she can direct me more.
Oh, just go online. Go online. Type back stretcher.
Okay. Back stretcher.
Back stretcher. Yes, just something that will give you correct positioning.
Okay.
The light thing.
All right, thank you.
Okay, thank you so much for that. I believe.
I'm so sorry. Is it up?
Okay, okay. All right,
give-
all right.
Yes, we help you correct.
Okay.
Okay,
Right.
let's quickly, because of time, let's listen to Ukamaka. Ukamaka, are you here?
Yes, I'm here.
All right, please, your question quickly.
Okay. Please, I want to ask. Last
Can you put off? Can you turn on your video?
Okay. Okay. Can you hear me now?
Yes.
Okay. The last week Wednesday, I asked them. I talked about somebody I'm treating that said that he took, after taking the JIGSIMUR, he could not go to toilet again. That the stomach was swollen and big. So, and I was advised to tell him to use warm water in the morning, add a little salt into it. So I told him to do that. He did that. And he's still complaining that he's going to toilet more, not normal like before. So I sent him this Zoom address to join the meeting. He was complaining he could not join. I wanted him to join and explain by himself, but he could not join.
Okay. He is on high fiber food. His food intake is high fiber food. Don't worry, by the time he starts going to toilet, he will call you and also shout again. The moment he's taking, he should not stop the warm water and salt now. He should just keep taking it. Please, he should also take plenty of fruits and also drink water. JIGSIMUR is like Omo. When you put it in water, when you put it into the stomach, it does not see water to work. It cannot do anything. Water is the activator. Tell him he should drink plenty of water. Please. Yes.
Okay. Thank you. Okay, then, and the other woman, the cancer patient, I also spoke about that last week. That she's now, that the wound escalated. She was telling me, because I told you when I started giving her, she bought a pack. After like a month, she called me and told me that what she's seeing, that the wound was healing. First, I asked her whether they cut the breast. She said no, that they said her own is not, her own is hormonal. And she was not taking drugs, that they were just doing chemo for her. They did chemo 2 times. So only for her to now come back and tell me that the thing became worse, that thing escalated. So, and I've been asking her to send me the picture. You know that last Wednesday, you told me that she should send the picture. So she just sent the picture this night. I will post it in the group after this meeting. She just sent it to me this night. And she could not join the meeting. She said she's in pains. So, and I was asking her about that because she was supposed to have finished the first pack, that first pack. She bought it in June. And I advised her to be rubbing it all over. She was using it. She told me that after cleaning the place, she will use gauze to hold it. And the breast was not cut, but the breast is no longer there. Thing ate up. I don't know whether she said the thing disappeared. The thing was eaten up. It was not cut. They said they don't need to cut it. But from the picture she showed me, the place is eaten up. So she was not telling me that the thing escalated and kind of pus was coming out. So now the way she's talking is that she's afraid to continue with JIGSIMUR. I've been telling her to get a second pack, that she should not stop. And the salt water she was not taking. She started taking it recently. So she was really not following the prescription.
Yes, I've got one pack since June and is treating cancer. She's not on JIGSIMUR treatment. She's on maintenance dose.
I want to say something here. Please, have the person undergo chemo?
Yes, 2 times. She said the
And
first
what
one was in 2020. Then the second one was January this year. She
What
stopped
I
in
normally do with cancer patients, I'm not so much in haste to tell them, don't go chemo, don't listen to doctor. Cancer is one of the most wicked ailments. And why is it so hard for us to treat? Everything we eat in this Nigeria build cancer. So if you must, what is her diet? I have someone that is treating cancer. She tell me she eat pepper soup. I told the woman, I have not started. Because the one you killed, in the morning you build it by what you eat. Remember, cancer cannot survive in any cancer grow on sugar environment. So you must know what is eating. And those
she
people,
avoid sugar.
you can go and visit one.
Boss,
Boss,
please, this woman is not even on cancer treatment.
It's not.
She's not. She bought a pack since June. And you know this is September.
Yes.
You're on cancer treatment.
And she's supposed to use it to rub on that place, to brace it morning, afternoon, night.
Yes. She's not on treatment.
Yeah. Make sure you have, I want every distributor to have everything you need. Make sure you have this at home.
Apple cider.
Yes, and all those things that you need, so that when you talk, apart from you giving, when you are describing to patient, you say, this is what, as cancer patient need this, or lemon. And also the food intake and the organic food. If you are not obeying this, you are not doing treatment, even in hospital. You are not meant to eat yam. If you must, it's white yam. Then all your food will be organic for you to see results.
Stay away from Stay away from containers.
Yes. Some people will tell the doctor, say they will not cut this breast. This and that. Who are you keeping this breast? If you die, your husband will marry another wife. If it takes for you to save your life, because it's a very wicked, is one of the most dangerous. Because if you treat it, if there is only one single atom of cancer, it will grow over. Please tell the woman that she should not do this. Mind what you eat and also be serious. Make sure that shower and shop water or leaf. Make sure you are drinking it, or apple cider, or then shredded coconut is very important. Kill all this then garden egg, all this something that will reduce the power of the cancer. Please.
Okay.
Please look at this.
All right.
This is what she was treatment. This apple cider. If you're taking treatment for fibroid and cancer and you don't have this, that means you're buying lemon every day. So, and it's not easy to get lemon every day. The best thing is to buy this by Bragg, the organic one.
You see, we are doing treatment. I love it.
Okay, any more questions?
Thank you. Can we listen to Stella Uma?
Good evening.
I joined the organization recently, and the first patient I'm treating on have a it's now that I noticed that I'm supposed to know more detail about later. My question is on third now. He said that he's just with pain. Even pain is even more before he started taking the
No, I can't hear you.
Sorry, Mrs. Stella Uma, personally, I can't hear you. I don't know if any other person is hearing you.
Are you hearing?
Your line is not going well.
Off your video so that we can hear you.
It has nothing to do with the video. Most mics are unmuted. They should mute their mic if they are not the one talking.
Okay, can we quickly move to the next question? Oracle himself. Oracle himself.
You don't go consult all.
Yeah, good evening.
Good evening, Oracle.
To all my great leaders in the house.
Yes.
I really appreciate this wonderful training this evening. I must say this is the first time I joined this wonderful company. I am going through this wonderful lecture. I appreciate it. I also want to beg if this will be coming up often.
Oracle, talk with your problem.
We don't get problem. I enjoy this program.
That will be his problem.
That's my problem, especially time.
Oracle, please unmute yourself.
Yeah.
Oracle, unmute yourself. You are muted.
Okay, I've done that, sir. I'm sorry about that. Can you hear me now?
Yes, we can. Please go ahead.
Yes, I think it's a very wonderful program that if I join JIGSIMUR, this is the fourth time I'm undergoing this beautiful training. I've never gotten this wonderful opportunity before. I just saw this Zoom link yesterday. I just said I'm going to be part of the Zoom meeting today. So I'm really, really filled with this beautiful training. So I want to beg that they should do this often so that we can share it with all our downliners. Are you with me?
Don't worry, there'll be a link because this training, this webinar is recorded to the cloud. So there'll be a link that will be shared across all groups so that you can go over the meeting again and again.
Okay. Thank you very much. God bless you all.
You're welcome, sir. Thanks for the commendation. God bless you.
All right, sir.
See you at the top, sir. All right, Lady Kema. Lady Kema. Is Lady Kema on this call? Please unmute yourself, turn on your video, ask your question.
Yeah, I'm here. Good evening, house.
We can't see your face, please.
Are you seeing my face now?
Okay, we can see your wonderful face now.
All right, I have a question that is as regards to my client, one of my downlines. He's my patient and also my downline. He's complaining that he has taken up to 9 bottles since he started. I was treating him of diabetes, high blood pressure, and he said he's obese too. So he's complaining that since he started, he has taken up to 9 bottles. He lost only 3 kg. And the diabetes, not much has been recorded as in the reduction of the sugar level, and the BP is not coming down as expected. So it was like he's not really having a testimony to share with his prospects and all that. So that he's feeling discouraged. I asked him about his lifestyle in terms of dieting, exercise, and all that. He said he's observing and taking the warm water therapy prescriptions and all that. I said, well, he should exercise patience because I feel this JIGSIMUR, it all depends on body metabolism and it works differently depending on individuals. So I encourage him to continue. I even asked him to join this class so that he can ask questions and also learn from here. So he's not here now. I've called him, he didn't pick. I don't know, maybe he has slept. So I don't know, what do I tell a person like this now?
Okay. First of all, for sugar and weight management, if you're taking JIGSIMUR for sugar and weight management, there is a time frame the person should eat. You cannot eat like me now, just came back. What's the time? Maybe after 10, after this thing, I'll now go and eat. After eating, I come back, I lie down and sleep. Tomorrow, I will now expect my weight to drop or my sugar to drop. It will not drop because digestion has not properly taken place. If he's going to watch his weight, he's going to watch what he eats, the hour, and that's in the time he eats it. The most about weight watching has to do with the kind of food you eat and when you're eating it. If you're eating very late, immediately after eating, you're sitting down, the next thing you want to sleep, my dear, results will never come. I remember when I was using JIGSIMUR to treat my leg, I was advised to also watch my weight. I actually lost the weight. I lost the weight because then I stayed away from all the bad habits they told me because the leg was giving me problem. But after that time, I came back and my body also came back. So he's treating diabetes. The hour he eats and the kind of food he's eating is the thing. And diabetes, remember, diabetes does not develop. Diabetes is not part of the ailments that you just stay and begin to have diabetes. Diabetes run in a family line. So if you're treating diabetes, you also have to do extra touch to it because it's already there. When a child is born, a child that has diabetes, if you go and run a test, there are certain tests the child will run. They will tell you that this child is going to be a diabetic patient. When he or she reduces activity, that's when the diabetes comes up. That's why you see that diabetes begin to show at 45, 50 years. That's when you begin to see it. Because at that time, you are no longer running up and down, using up the sugar. The sugar begins to show, look, appear. So now that he wants to treat, he has to also check the time he's eating and his activity. I'm doing sports, I'm licking fruit. So pineapple is not part of the fruit that you count. Agbalumo is not part of the food. A BP patient is not supposed to take agbalumo at all. A heart patient, a kidney patient is not supposed to go to agbalumo at all. So when you say you leave food, the person will not tell you I took pineapple and agbalumo. Those two foods are not part of the food that we use to treat illness.
I'm sorry.
All right, thank you so much for that. I believe we can move to Mr. Lawal Mohammed. Mr. Lawal Mohammed.
Yes. Can you hear me, please?
Yes.
Yes, I say for the complete duration of treatment of HIV, what is the normal duration to have a complete cure?
I have answered this before, like I said, that it has to do with the body. Your body's fast acceptance of medication and the underlying ailment that is already there. Somebody that has HIV, he or she might not know he has HIV until he starts disturbing him. And when he starts disturbing, something has actually decayed. So you take, as the person is, that's why I always say, go and check your viral load. It's from your viral load we know whether we are treating you or not. Because for anybody in Nigeria that says, I am HIV positive, before he or she is able to find out that he is HIV positive, there is something now that has started disturbing him. They will not tell you. So those things has to be taken care of because it is actual decay that has brought up the ailments. The time frame cannot, even the doctor cannot tell you how many tablets of Panadol or how long Panadol will take care of your ailment. They only tell you if symptoms persist after 3 days, consult your doctor. If you're taking treatment with JIGSIMUR, the minimum time is 3 months. as long as 6 months. If that much long, there is no result, come back, let's see. But before 6 months, please, always consult somebody to say, this is the way I'm taking it to. Let's know if you're going on the right track.
Okay.
So there is
Okay,
no
the
time.
next, the next question is it why does the skin goes fairer, the complexion, after beginning to use JIGSIMUR? Is it from the effect of the herbs?
That somebody is using JIGSIMUR and it became fair.
Yes, a little bit fairer than before.
Well, you see, when somebody is suffering from something, the whole system is damaged. JIGSIMUR does not change anybody's color. It's not a bleaching cream. It doesn't change you. It does not make you anemic. It's just
I
that.
understand.
So when it starts detoxification and the person becomes fair, just know it that person, that's the original color of the person. It's out of the sufferings or the death inside the system. That's why the format you are seeing.
Okay.
Yes.
Yeah, thank you very much, madam.
You're welcome.
All right, let's move to Becky Austin. Please unmute yourself.
Yeah, good evening, everyone.
Good evening.
Yes, well. Please, I want to ask a question concerning hernia, the treatment for hernia. Yes. Well, though I have a patient that have hernia, and I'm trying to encourage her that JIGSIMUR will take care of it. So I want to be really sure about it. And another thing, I have a testimony of HIV patients. Though, like what Madam Stella said, treatment or whatever one takes, it depends on the body chemistry. Yeah, the day they brought the lady, she couldn't walk. They just brought her to my office. Then that was in the morning, and I got warm water. I boiled water in my office. I got warm water. I gave her to drink. Then I ran around and I get the lime. I get a lime. And I make sure this Shinap cup, Shinap, the glass cup. Then I make sure it's full, and I added a tablespoon of lime to it, and she took it. So after about 10-15 minutes thereabout, she slept off. And I allowed her to sleep. She slept in my office. Then after, she even when she was going, they didn't support, the guy that brought her didn't support her, she walked, she was the one that walked, with her leg to the cab. So I said, for there are some people, most of all these people, they hardly open up to share their testimony fully, in a good details, So I keep on following, chatting her up, following up, checking on her. So most of the time I will say, how are you? How are you feeling? You say, I'm fine. I'm getting better. So I was kind of trying, that's a testimony that I needed. She's not giving. So only for her to send me a birthday invitation that she'll be doing her birthday on the 20th of September. And see, she just bought a pack. She bought it when they did the promo, 5 bottles for 70,000. Yes, when they did promo of 5 bottles, it's only that one pack she bought. So the other day, I was kind of somebody that could not walk, but now she's celebrating. That means she have getting up. I was kind of asking her to go for how far. How are you doing? Have you gone for tests to check? She said that she's fine. Said she's fine. But I still encourage her to go and run tests. So that is it. That is testimony for HIV positive patients that are treated with a pack of JIGSIMUR products, and she's fine now. So I want to know how to go about the hernia of a teen, because what make me to ask the woman or to encourage the woman to go for JIGSIMUR, her sister was the person that directed her to me. So she said the woman have gone for hernia surgery twice. I was kind of, woman, surgery. It's only fibroid that I knew that after surgery it will outgrow back. So I've never heard of a hernia of a teen. So she had gone for the hernia surgery for twice, and now the third time the hernia has grown back, and the doctor was asking her to come for the third surgery. So I asked them to wait, let her try JIGSIMUR, that JIGSIMUR will take care of it. So I want to be really sure of what I'm saying. Thank you.
Okay, thank you so much. I'm happy you talked about your 8 patients. Lyme is a disaster. Don't give women Lyme. Lyme will cause infertility.
Okay.
Men. Lemon. Lyme has a higher acid. That is why you can never hear of any medication when they will say use lime, except in very, very, even at that, they will have to add something else to the lime for them to use it. But thank God he helped the AIDS patient, the HIV patient. If you ask for testimonies, forget it, they will not bring it. They have a test.
Yeah.
They have a test kit. Just ask her, use your test kit, screenshot your result, let's see. They can do that one easily. But to come and tell you that I'm good, and then no, do you know how hard it is to accept that you are a HIV positive person? Now, for this person that has gone through surgery, I don't believe that that is hernia 3 times. What is hernia? Hernia is just part of the body swelling up by the left, I think it's by the left side of the abdomen, large abdomen. So you cannot call that same part 3 times. It's just one part, just like appendicitis. So that cannot be moved 3 times. Let them tell you, it's already swollen, my dear, just like appendix. I'll not tell you that if you have appendix, come and use JIGSIMUR. JIGSIMUR is not an emergency drug. JIGSIMUR is a therapeutic drug that takes time to enter into your system and treats. So if it has actually swollen up, that it has gotten to come and do surgery, allow her to go and do surgery. Don't keep her, because if the thing ruptures, you are in trouble with yourself.
Okay.
But immediately after surgery, you can place her on JIGSIMUR, because JIGSIMUR will help her heal. And we heal permanently. There will be no, if that, I suspect there is a growth. You know, doctors can, or she gets octopus pregnancy. That's pregnancy outside the womb. Those are the people I know that suffer such things. The people that suffer such things, doctor will tell them appendicitis or is hernia. They will remove, because that child will never survive. Pregnancy outside the womb. So if she does her surgery, she can use JIGSIMUR. It will heal the pain and whatever will be healed. Now that it's big and they should not remove it.
Okay.
All right, thank you. Can we move to the next question? Yeah, Onyechi Kiru. Please unmute yourself, Onyechi, and turn on your video so we can.
I don't have like good evening, sirs.
Good evening.
Can you hear me? Good evening, ma. Good evening, sirs.
Good evening. Can you turn on your video, please?
I don't have light here. There's no light.
Okay, please go ahead quickly.
Okay. My question is this. I have I'm the one in question asking this question about myself. I took JIGSIMUR products. I just see my period, I start taking JIGSIMUR products. So the thing make my cycle to extend because I normally have 4 days cycle. So this one now gave me like extra 10 days cycle. So I was wondering. Then after that, this month I saw it again. I not take it because of what happened last month. So it now gave me normal 4 days cycle as usual. So now my question is this. I did the CS when I gave birth to my son. So I don't know if the product I took caused injury for me when I took it, because I can't imagine having my period this month, having it normal staple, why last month was not normal. So I want more light on it.
Okay, have you done any tests on fibroid before?
No, I don't have.
Okay. The JIGSIMUR, you did surgery. Sorry, you took JIGSIMUR last month and you had more days.
Hello?
Can you hear me?
I'm not hearing you clearly.
Hello, can you hear me now?
Yeah, I can hear you now, sir.
Okay. You took JIGSIMUR last month and your menses was low.
You say what? This is breaking down.
Last month and it stayed more days.
Okay.
I advise you take JIGSIMUR again.
Now I should repeat it again.
Yes. There is 2 things that is there. I wish you can go back and do a test. This is a guesswork. But I tell you, you are a fibroid and it's multiple, the small ones. You might have not detected, but that is the question on ground. Or when they did surgery, the cleanup was not complete. Because when we say JIGSIMUR detoxifies, it removes everything unwanted in your system. And that is what it was doing for you. I wish you can continue or go back and do a test and tell them, don't tell them, but just tell them you had a problem last month, see what happened, and let them run a test and tell you what it is.
Okay. Then I have another question. Then another question that I have someone that complained of kidney stone issue. He said that he have operated it, but he's now over-urinating day and night. So I encourage him to take this JIGSIMUR product that it will stop it. And the person said that the doctor said that he should not take anything bitter, that it will harm his kidney.
Okay. She has to choose.
So what will I do? Hello? Did you hear my question?
Affect to do with the kidney. The bitterness in
okay.
The bitterness in JIGSIMUR does not harm the kidney.
Okay. So he should key into the product or what?
Yes, he should key into JIGSIMUR product. And it's somebody that has kidney stone that has not that after some time the person will go through another surgery. Kidney stone is a sickness, not a sickness. It's dehydration that causes stones. And food without having enough water to digest it. The ones that stays in the kidney stays there to form things like stone. Those, they are not stones. If you also take something that can help you in fast digestion, after some time, if you are using JIGSIMUR to treat it, when you go to toilet, you will feel sandy. When you touch because when it starts purging you, you will see something like sand. You find yourself passing out sand. Those are the cracks that are coming in. And it's from, as he is now, he has to stay away from plenty of salt, pain relievers, drugs, capsule drugs, those plastics in drugs. Sometimes they don't go down well, they remain there. And you need to plenty of water. But we have it bad that drink with Coke. Even Coke, if not well flushed, stays there to form the stone you're talking about.
Okay. I'm not really getting this.
Okay.
Hello?
All right, Mrs. Nkuru, I believe your questions have been answered. Thank you. Let's hand over the microphone to iPhone, the only iPhone user on this call. iPhone. Okay, if he or she cannot hear us, please let's quickly move to Olutoyin. Mrs. Olutoyin, please unmute yourself to ask your question. Mrs. Olutoyin, I sent you a request to unmute yourself. Unmute yourself.
Good evening, ma. Good evening, sir.
All right, good evening.
And I want to thank mommy for the useful information that she's been passing us. I want to ask a question concerning using JIGSIMUR for weight loss. How do we use it for weight loss? Or weight loss or big tummy?
If you're taking JIGSIMUR for weight
my
loss,
question.
same way of taking it. First thing in the morning
Stellababy, we can barely hear you.
Can you hear me?
Yes, ma'am.
Now. Hello.
Hello, ma. Little bit, ma.
Okay. If you're taking JIGSIMUR for weight loss, every morning take warm water. Please buy apple cider vinegar by Prague. Because if I say lemon now, some of you can be taking time. Put lemon in the hot water, warm water early in the. Then please use starchy meals. Watch your food. Reduce your don't take alcohol at all. Reduce your starchy food. Stay away from sugar. Eat less. Control. Then eat before 7, and you start losing your weight.
Before 7 in the evening, ma?
Yes, I can see you on the road. Is it possible? Stay away from mineral. Stay away from junks. Stay away from desired weight is achieved. Then you do milk. Is it possible?
It's not, you are not audible, ma.
I said, can you hear me now?
Yes, ma.
I said, do early morning warm water and lemon. Did you hear that?
Okay, ma. Yes, ma. Early warm water and JIGSIMUR.
And lemon. Then do 30 minutes. Stay away from carbohydrates.
Okay, ma.
Do meal control. That is check the
do what?
Food control. Check the food you are eating and the quantity. No in between meal. 4-7 evening. That's all. You regain your desired needs.
Thank you, ma'am.
All right, iPhone. iPhone, can you unmute yourself, please? iPhone, unmute yourself. You are muted. Please unmute yourself. Check your phone, unmute yourself. Can we move to Apostle Solange?
Hello, everyone. Greetings to everyone in the house. I'm so happy. I just have a very quick question right there. I started JIGSIMUR. Can you hear me?
Yes.
Okay. So I started JIGSIMUR back in June, and I happened to have brought it over here in Atlanta, Georgia. So I gave it to somebody who just drank for 3 days and sent me a testimony that her ears have been blocked for 5 years. And doctors could not do anything about it. They told her to just wait. Whenever what is going to happen is going to happen. But she could not hear at all with that ear. But she drank it for 3 days. She told me actually in the voice that she wasn't faithful at all. And by night, when she woke up to use the restroom, a lot of liquids came out of her ears, and instantly the ears opened. So I was like, this is a wonderful miracle for you. But the thing is, she said she wasn't even drinking JIGSIMUR for the ears, that her problem was actually fibroids. So her question now is, JIGSIMUR has kicked out the ears, they are open right now. She's asking what is the best way she can do to follow strictly the fibroid. I know Mama has explained it. I came in a little bit late because I'm at work. I don't know if there is a way we can have a detailed way for the fibroids, because I believe fibroids is one of the main targets of the ladies and the clients we have on JIGSIMUR. Thank you.
What's her weight? What's her weight?
She's really slim. She's kind of like a medium person. I can say she weighs like 60 something.
Okay, she's really slim. Gets up in the morning, takes warm water. First 24 hours, no meal, fruits and vegetables, no oils. First thing in the morning, as she started, takes food and warm water. Are you hearing me?
Yes, we can hear you.
Yes, ma'am, I'm hearing.
Okay, glass of water with lemon. First thing in the morning. Through the day, no food. Do plenty watermelon, pawpaw, no pineapple, no sugar cane, no mangoes, no what's the name? Plenty of grapefruits. Anything that has to orange, that do with orange, fine. Then for 24 hours, no oil, just fruits. Then the next day, start with first thing warm water in lemon, same 1 glass. Let her take 30 mils JIGSIMUR the first day. And same 30 mils at night, but she eats her food. Stay away from preserved food. If she can eat fresh tomatoes, that will also help her. But stay away from preserved food. Continue that way for 4 days, 30 mils for the first 4 days, twice daily. After that, revert to 30 mils and continue twice daily every day. The meals.
Okay. All right. If I do understand really well, you said the 30 meals is just going to go for 4 days, and then after that she goes back to the 15 meals.
Yes.
Okay. Okay. All right. Thank you so much, man.
You're welcome. Yeah, opening.
Can we listen to iPhone? iPhone.
Writing for us.
All right. Good evening, everyone.
Good evening.
Good evening, everyone.
Good evening,
Can you
madam.
hear me, please?
Yes.
Good evening, everyone. Can you hear me, please?
We can, yeah, we can. Please go ahead.
All right. I'm Catherine, speaking from Benin. All right. I have heard what Auntie Stell have said concerning that treatment of fibroid. Actually, I had a patient like that, although she complained that it didn't work for her, but with her explanation now, I think I can continue with her, then we'll start all over. Then secondly, there is another of my patients. She used JIGSIMUR and she was okay, but the major issue is she's a BP patient. So she used JIGSIMUR, but now she still complains that her blood pressure is high. So we have been battling about it. So I don't really know what to do. Even yesterday I was with her. She still complained about it. That JIGSIMUR actually helped her in terms of weight loss, but the BP is a major issue for her now. So I don't really know how to go about the treatment.
Okay, much as we look at BP as a small ailment, BP is also a very stubborn ailment. The moment you start using BP, sometimes your BP will rise.
Yes.
Sometimes the BP will rise. It will start dropping, but it drops gradually. Please, let her increase her water intake. Tell her to increase her water intake. Then she cannot be a BP patient that is still buried in thought. Is my BP going to go? When will it go? How will I do about this? If you're treating something, if she's treating BP and buried in thoughts, it's going to take us a longer time to get her treatment. And she should try as much as possible to cut down on that intake. I hope she's an alcohol person. When you're treating BP, alcohol.
She doesn't take alcohol.
Okay.
She doesn't take alcohol. She doesn't take alcohol.
Beverage, Bonvita, chewing gum.
Not always. That chewing gum, sometimes she chewing gum.
Chewing gum is the worst thing. Chewing gum is the worst thing. That's why if you're treating fibroid, you don't need to chew gum at all. At all. Yes. Because it returns your saliva into your system. It creates saliva, it comes back to your abdomen. And those things. So BP is serious, but when it goes up, plenty of water. Remove yourself from the thoughts. BP, that one is not. I think it's sorted out.
Thank you very much. God bless you.
Please, everybody asking on fibroid.
All right, that's a perfect one. Please, can we hear from Obi Emmanuel? Mr. Obi Emmanuel, please, your question.
Hello, good evening once again.
Yeah, good evening.
Welcome once again, sir.
Please, my question goes like this. There's a patient I want to treat on eye problem. Eye. So how will I start and how will it go?
Now, before you talk of eye problem, is a person diabetic?
No.
Does he have high blood sugar?
No.
No trace of arthritis?
No, there is.
Okay.
It's not rheumatism arthritis. Not that much.
You have rheumatism and arthritis. 80% of the time there is high blood sugar.
No, but he has been he do go on test. I'm not seeing it because his BP is always at 120/80.
Okay.
120, 111, 122, 80. So
okay, just the normal way of taking JIGSIMUR, 15 ml twice in a day. Mix JIGSIMUR with water, 50-50 equal volume of JIGSIMUR and water. Wash the eye container properly. Wash properly. Then use it as an eye drop.
Okay, there's 50 ml of JIGSIMUR, 50 ml of water.
Not 50 ml, equal volume of
volume, okay, and water.
Yes.
Mix it together and be dropping it morning and evening.
Yes, when you drop it on the eye, close the eye for like 20 minutes.
Okay.
When they drop it correctly, the JIGSIMUR will come through the nose.
Okay.
If you drop correctly, it must pass through the nose.
All right, okay.
This should stay away from high calcium.
Okay, perfect.
Hello?
Hello, can you hear me?
You say it will stay away with
high iron meals, like snail.
No, it doesn't eat snail.
It doesn't eat meals anymore. It do more of onions.
Okay, more for yourself.
Yes.
All right.
It's salt intake. In fact, if it's possible, he can zero his salt.
Okay. All right. Zero is salt. Chop more onions and drop it morning and evening.
Yes, then drink orally too.
Yes, yes,
Also
yes.
be taking. Yes.
Hello. Also, they take what?
I said be drinking 15 mils JIGSIMUR morning and evening.
Yes, yes, I know.
Yes,
Okay.
that's all.
Okay. All right. Thank you.
You're welcome.
All right. Good night.
All right, we are glad you got values, Mr. Obi Manuel.
Yes, I appreciate it.
To Benny Peters. Benny Peters, please, you have the mic.
Good evening, everyone.
Good evening.
Yeah, I'm speaking from Wari.
They know they carry lights.
Worry people, I beg. Open your camera, I will see your face.
Okay. I actually
Can't find face, you go to hide.
I'm treating myself for this streptococcus pneumonia as strep throat. So I've been taking some antibiotics. Can you hear me?
Okay, I'm hearing you, but you also stop talking loud.
Okay, okay. So I was taking some antibiotics before now. I started JIGSIMUR.
Of what?
So treat what?
Okay, streptococcus pneumonia.
Okay.
So I've been taking a lot of antibiotics, of which it was resistant. So I started taking JIGSIMUR. I was introduced to JIGSIMUR. That's how I joined. So I'm in my third bottle now. The thing is that, like, I started since June, ending of June.
Yeah, 3 bottles.
Yes, ma.
Ah.
So at times I will feel some serious, and this streptococcus pneumonia, according to scan, it has yielded, according to throat swab, it has yielded a growth. So of which it has been the one causing the resistance. So many of the antibiotics Can you all hear me now? Can you hear me?
Come up and you go down.
Yeah.
Twitter mi ti ń gbọ́ yẹn wọ́n sọ ní kìnìún bí àwọn tó ń fẹ́ fast result wọ́n ló ń ṣiṣẹ́ tí kò ń ṣe àwọn tó ń ṣe rọ̀tídà.
So I was told. Can you all hear me?
Please go ahead. We can hear you.
Okay. Okay. I'm sorry. So I started taking JIGSIMUR 15 mils in the morning with warm water. At times I go with soursop leaf, or at times with lemon. With morning, last thing in the night. That's 3 hours after eating, and in the morning 3 hours before eating. So up till day, at times it will go off, and at times it will come back. So now it is giving me a very sharp pain in my chest, and at times it disturbs my breath. Like I'll be having some difficulty in breathing. But at times it goes down. So I don't really know if there is a better way for me to take it. Thank you.
You are taking it correctly and wrongly. First of all, 3 bottles from June is not possible.
Okay.
Maintenance. You have pneumonia. Pneumonia is congestion. Now, for the fact that it has stayed too long, you would have sore. There are times when you will bring out blood from your system. Is that true?
No, I have not seen anything like that.
Okay. Now, if the pneumonia is severe, there are times when you cough out or bring out through your nose mucus that has blood combination, or sometimes you bring out just mucus. Have you ever brought out mucus?
Yes, plenty of mucus.
That means it's not. Yeah. Now, the drug you are taking, I want to explain something in a layman's language to you. You see earthworm, when you want to kill earthworm and you put salt. If you allow the earthworm, immediately you put salt, it will run. If you allow it to survive again. And when you, after some time, if you put salt, it won't work. But if you put salt, it runs, you go back and put salt again, it will die. What you have is vitamin C deficiency. And JIGSIMUR has vitamin C. And it has to detoxify. Detoxification is bringing out those mucus from your chest to free you. But you are not taking the drug constantly so that it brings out all the mucus and you'll be free. You take it the days you like or the days you feel pressed. JIGSIMUR is not an emergency drug. If you want to take treatment, face the treatment correctly, finish it and stop. Or just run it like a maintenance drug. Truly, it will not cure you if you run it on maintenance. And pneumonia is a bad one because pneumonia, when it gets severe, that's why I asked you if there is blood coming out now.
No, there is no blood.
There are times when it gets so severe, blood will come out of it. Because you know, trying to breathe, you are not able to breathe. You drag, you wound your chest.
Yes.
And that is where the blood will start coming out. So please take JIGSIMUR back to back every day, every morning and night. For the period you're going to be taking JIGSIMUR. Warm water right now, because you have pneumonia, you don't even need cold water, ordinary water. Don't allow your feet touch the bare floor. You should be inside the house. You should wear something, stockings. You should cover yourself properly until treatment is completed. Enjoy it while you're taking this treatment. Please.
Okay. Thank you very much.
You're welcome.
All right, thank you for joining this meeting. Let's move to the quite nice person quickly, and that's Grace. Grace. Grace, please unmute yourself. Let's hear from you.
Okay, good evening, everyone. Hello, can you hear me?
Yes.
Can you hear me?
Good evening, we can hear you.
Okay, my question is on ulcer, the right treatment for an ulcer patient. So he said he's already passing out blood.
Wow. The right treatment is the right way before meal, but that can be very, very painful. So after meal, the person should take 15 meals.
Okay.
And drink plenty of water.
Okay, 15 meal morning and night, right?
And drink plenty of water because ulcer is just a wound in the duodenum or in the large intestine, depending which ulcer it is. It's a wound. And since JIGSIMUR can heal wounds.
Okay. Okay, thank you very much.
Yes.
Right, let's move to Ikechukwu Odo. Ikechukwu Odo. Ikechukwu Odo, please.
Uncle Taiwo, let's.
Hello, good evening.
Yeah, good evening.
Okay, sorry, I joined late and I am equally having network challenge here.
Okay.
Can you hear me? Yes. I'm interested in knowing the treatment, maybe you may have thought about it, the treatment requirement for the HIV of a teen, because I know one of my downliner who has been on it for taking up to 2 cartons of JIGSIMUR, and it's still showing.
I like carrying bottles.
How many bottles in a carton?
12, is it not 12? There's 12 bottles in a carton. They're taking up to 2 cartons. That's 24 bottles. And it's still showing a positive. It rose, it was 60, I think 70, And when he stopped taking ARV, it rose to 5,000 plus. Went back to using JIGSIMUR and ARV, it fell down to 20, less than 20. But all the tests I've carried for the past 2 years is still showing positive. So what is the treatment, the real treatment requirement, so that I can fully encourage the person?
Okay, first of all, sir, there is no way he will use 24 bottles in 2 years from JIGSIMUR. It's not possible. Then ARV is not a medication, so he doesn't need to stop using it. ARV is just, it doesn't treat it, stops. It does not do anything. ARV is just to make sure he does not transfer from himself to any other person.
Okay.
That's what ARV is. The actual drug that is JIGSIMUR. He has checked his viral load. If in 2 years he took 2 cartons of, that's 24 bottles, he did not do treatment. He's just lucky that the thing is coming down. He wouldn't. He cannot use JIGSIMUR for 6 months, 9 months, not stop the. He said he started to change to negative. The highest I got in results 6 months. So there is no way. The highest number of months that somebody has treated HIV that I am aware of is 6 months. So I want to say, let's say he is a little careless or something. Let's give him 9 months. He cannot be using JIGSIMUR for 2 years. The thing can come down to 20. There is something he's doing wrong.
Okay.
He has to, the medication is start, don't stop until you come to 0, you come to negative. He shouldn't stop the ARV because for our own security, he has to be on ARV until he's proved negative.
Okay.
ARV does not treat anything. It's just stopping him from transferring to another person.
Okay.
Then he's treating only himself. What of his sex partner?
No, only himself. The partner has died before he died. The partner died before he knew of it. You know that.
Okay. So right now, I don't have any other partner.
No, he doesn't have.
Okay. Let's believe that.
Yes. So what they do? So what they do? 30 mil for how long? 30 mil.
No, he should do, if he has started JIGSIMUR a long time, he should be doing 15. Is he fat?
No.
He should do 15.
15 mil?
Yes, daily, yes.
Morning, afternoon, and night?
No, twice, morning and night. Do the hot water therapy and then take 15 mils, morning and night. Try to stay away from alcohol.
Okay, which one is the hot water therapy?
Take warm water first thing in the morning. The warm water should have lemon inclusive. Or you should buy apple cider vinegar. Your video is not on. I would have shown you what apple cider is.
I can see your this thing. We don't have. I can see we don't have light.
Apple cider vinegar by brand. This is organic. It's organic. So you apple cider vinegar. Look at it. Just
so how do we?
In warm water.
Hello?
I'm listening.
Okay. You eat it in, put it in warm water.
In the morning.
Okay.
That's all.
It's okay. We'll keep in touch.
No problem.
Thank you very much.
Thanks.
Right, can we quickly move to Blessing MA, please? Blessing MA.
Very well, thank you. Great job, man. Thank you so much.
You're welcome.
So I'm saying that dietary.
I can't hear you.
Can you hear me now?
No,
Can you hear me now? I'm actually sure. Can you hear me now? Okay, I just asked that the 50% how long it's supposed to stay before you dispose?
it's not 50%. I said equal volume of water.
Yeah, that's what I mean now. Equal volume, 50% of water or 50 volume of
Like I said, for the
I can hear you.
Stellababy, we have an issue with your microphone. It's giving an, yes, it's popping a particular sound, an unusual sound.
From me?
Yes.
From my.
Can you hear me? Can you hear me?
Of course, we can hear you, Mrs. Blessing. Stellababy, please, you are muted. Please unmute yourself.
Okay. Okay, so I think hello.
There's an issue with your microphone, with your network, Stellababy.
My phone.
Yes, it's
But
from you.
Just hide. Yeah.
Miss Blessing, can you speak? Let's hear you.
Okay, can you hear me?
Yes, I can.
Okay, just a quick question that volume of JIGSIMUR, have a number of duration. That's my first question, and the other was
I can't hear you.
It's okay. You can call someone else. I appreciate you so much. Thank you.
But can you hear me?
Yes, I can.
But I can't hear you. Hello? Hello?
Oh, sorry, I was muted. Can we call the next person? Eukarya. Please, you can speak. You have the mic, Eukarya. You can speak up. If we are unable to hear, can we try Tech Global? Tech Global, please, can we hear you?
Hello?
Hello, good evening.
Good evening. Hello?
Hello, we are listening to you.
Yes. Yeah, please, I just want to, I have a client that I'm working with on travel and on JIGSIMUR, and he has an issue with stroke. So we've been trying to manage that case for a while now, but we have not really seen that improvement.
Okay, I've been wondering why nobody has talked about stroke. Stroke is a blockage of the arteries from flow of blood. And naturally, if the person was caught early when the stroke started, all you needed to do was to use pins on the thumbs and the toes of the person. Massage until there is until blood comes out.
Okay, you said you use pin. Is there something pin?
Yes, if we caught the person when the stroke was still fresh, still new, use pin on the thumbs and the toes of the person. They use JIGSIMUR, rub the body of the person with a natural or a massage until there is blood coming out from those places where you feel.
Okay.
This long.
Okay. Like when can we say it is fresh and when can we say it is long, so that we know the duration of being fresh and being long?
When it's a partial stroke, is fresh.
Okay.
Hello?
Yes, I'm with you, ma'am.
When it's partial stroke, is fresh. That time the organs are not down. But when the stroke is complete, that means one part of the body is almost paralyzed. That part of the body that is almost paralyzed is not the problem. The problem is at the part of the body that is not paralyzed. So that is the place you need to massage to get results, not the paralyzed area.
Okay.
Are you getting me? Now, give the person, first of all, habits. A stroke patient stays out of high cholesterol food. Then also completely covers his or her body for warmth. No matter how hot he or she will feel, he has to cover his body for warmth. Make a move on the bloodstreams. Then In the evening, when you say 5 or 6, somebody comes to massage the body with JIGSIMUR. I have something they call Fuchsia pump. Fuchsia pump is Fuchsia gun, sorry, is an instrument. When you put it on, it massages the body gradually from head to toe. You hold it, it's like a gun. You hold it and massage. As you're massaging, you're pushing to see where, move the blood. And when you start pushing, when you start massaging the person, you have to drag the earlobe of the person. Massage the earlobes properly until it changes color. The left side and the right side. Same thing as the leg, the left and the right. But the hand, just the side that is not where you say it's not affected, and the whole body of that part where you say it's not affected. Rub JIGSIMUR and massage with shea butter on top of JIGSIMUR. Did you get that?
Yes, I get that.
Okay. Keep massaging. Do the massage twice a day. The person should stay away from all this oil that you keep and they will sleep. The food, his or her food, should try as much as possible to be as natural as ever. Stay away from preservatives also. Stay away from alcohol. Stay away from any form of cold.
Cold.
For that, cold. That means if you have tiles in the house, he should not put his leg directly to the tiles. He should wear stockings. He should not go and say, I'm feeling hot, because when you start with this treatment, you'll be feeling hot. You should not say it's feeling hot. Grab that cold water or cold drink. Then anything soda, any drink at all, you should stay or if you take the small order. Most times I tell them because all we want is detoxify and push. The moment the blood streams unclog, he or she will be fine.
Okay. What of when the tongue is starting to be numb?
I've told you what to do. When you start massaging, that is of the body not getting blood. So everything will tell you towards that side that is
okay. All the area, whether the left hand with the numb. So we do not touch that affected area. We just focus on the
massage, but not like the unaffected area, because the problem is for the unaffected area. That area, that's why that area is coming down. If you massage part that is affected seriously, the body will peel. It is the that you call not affected. That is where the problem lies. So that is where
the one that is not affected is the one you focus the massage on.
Yes. That's where you massage thoroughly. But you massage the other side, but not as much as you massage the unaffected area.
Okay, and we should follow the normal standard JIGSIMUR 15 ml in the morning, 15 ml at night.
Yes, it depends on fats. 30 mils for 4 days.
In between, it's an average. It's not too thin. It's not fat. So it's in between.
No, I've told you, do 30 mils for 4 days, 1 week, then revert to 15 mils twice daily. And let him or her not eat late.
To not eat.
Because what
All right, thank you. Akpo Mercy, please unmute yourself and ask your questions quickly and briefly.
Good evening, everybody. Thank you very much. My question is...
Please, I want to plead to the entire community that after birthday Samuel for tonight, we may not be able to entertain more questions because this particular call was scheduled for 2 hours and we've exceeded our 2 hours scheduled for this call. Samuel will be the last last question we're going to take tonight.
My question is, can one take the seed alongside BP drugs?
Yes.
Okay.
It's supposed to be taken first thing in the morning before meal. Any other orthodox drugs is after meal. So take JIGSIMUR. You can take your orthodox drugs 2 hours after JIGSIMUR.
Okay. Then what
if you're a patient and you've been on drugs, your body system is so used to that drug that if stopped automatically, you will have crisis. So we say run the both of them together until you to such a time when your body is also used to JIGSIMUR, you can start dropping your drug.
Then what about for weak erection?
Huh? Take JIGSIMUR. That's one of the easiest things, JIGSIMUR.
I'm not hearing you. Hello?
I said JIGSIMUR takes care of weak erection as easy. In fact, as you're taking JIGSIMUR, I was treating somebody of stroke. The complaint the wife gave me is that the husband that you will be begging now is the one disturbing up and down. And the man also told me that he will want to stop taking this drug because it's making him want to stay with her, and he's not supposed to stay with a woman because of the treatment we are going through.
Thank you.
Any other question for the day?
Yes, Betty Samuel, can I go now?
Yeah.
Good evening, everyone.
You're welcome.
I'm speaking from Port Harcourt. Please, I have somebody that has pile. How did the person take JIGSIMUR? How many bottles will the person take for the person to be all right?
That's how many bottles, a question that doesn't have answer. So even the doctor cannot tell you how many tablets of Panadol will stop headache on somebody. They only advise when symptoms persist, come back to the hospital. And JIGSIMUR, when symptoms persist after 6-9 months, you tell us, but if you are not seeing any result at all, come back to us. Let's know how you're taking it. Pile, when you're treating for pile, you take your 15 mils normally in the morning. When the person goes to toilet, there is a protrusion. Even if he or she don't have long protrusion, but tendency of protrusion. When you're going to, you have to prepare yourself. You go with bottle that can sprinkle water. Put JIGSIMUR inside that container, please. If you're removing JIGSIMUR from its bottle to another bottle, make sure that that bottle is properly washed. And most times, sprinkle containers are in rubber. JIGSIMUR to be left in rubber. Just turn it, the quantity you need, into that sprinkle bottle. After using it, we are Port Harcourt, we wash with water. Wash your ass with water properly. Sprinkle JIGSIMUR on the anus. Anytime you go to the toilet, do that until the elasticity of the large intestine returns back. You no longer protrusion making. Immediately the protrusion stop, you stop. You stop the sprinkle, but you have to also take it small. When your body tells you that you no longer kind of this.
Thank you very much.
You're welcome. Any other question?
Eukarya, please go ahead. Is she online? Eukarya. Oh, I'm not sure she has a network connected right now. At this point,
Hello.
I'd like to
Uncle
yeah,
Taiwo,
express.
for completion.
Sorry?
Let's
Why, man? They know they hear me now. They talk. They know they hear me. Because when I don't meet them, I don't talk. They know they
We
hear.
are hearing you.
Okay.
Yes.
Please ask your question.
Please, ma, I'd like to find out how to take JIGSIMUR for bilateral tuber blockage. The quantity to take, the dosage.
Treat it like a fibroid patient.
Okay, ma.
Any other question?
Yeah, I'm pretty nice to have every one of us on this call tonight. Okwe Beatrice, it's 11:21 in this part of the world, and I'm sure that not everyone on this call are on the same time zone, right? We are not on the same time zone. I want to express my gratitude to everybody who actually took out their time to come for a training like this. Please, this is at a point on this call, I feel encouraged because this particular meeting can accommodate 100 participants, but the highest we got tonight was 92, quite encouraging. So in the next meeting, I'd urge us to invite our downlines, our prospects. You see, trainings like this will always help us. How many training centers do we have across the country? And we have JIGSIMUR, not only in Nigeria today, we have JIGSIMUR in different parts of the world. And everybody needs to be trained. Everybody needs to understand what we are selling and what we are using, right? Because if we don't understand it, as the saying goes, that when purpose is unknown, abuse is inevitable. So let's always invite others, and all this that we have learned, let us pass them across to our downlines. If we are team leaders, let's pass this across to our downline, right? So that they too can benefit from it. Thank you so much, everybody. Stellababy, I don't know, would you mind attending to Okwe Beatrice before we close?
Okay, let me attend to her.
All right, Okwe Beatrice, please, quickly, your question.
Hello, Okwe Beatrice, are you still here? Okay, since you are not here, I'll say thank you everyone for your questions and your contributions.
Hello, she's actually talking. She's talking, but we can't hear her. So thank you so much, everybody. Mrs. Madam, Lady Evangelist, Okwe Beatrice. We actually wanted to take your question, but probably you're having a terrible network where you are. So sorry about that. or your microphone, your phone mic is really not working properly. So thank you, Stellababy. I want to doff my hat for you. Okay, I doff her for you. Thank you so much. God bless you. It's really a wonderful session tonight. It's nice having you around for 2 hours, 30 minutes. You've really done a wonderful job, and the Lord in His infinite mercy is going to reward you for this right here on earth and in life eternal. For everyone who stayed on this call up till this moment, 11:24 p.m. West African time, I say thank you. The knowledge you have acquired will not just go in vain. It is going to bring more souls and more sales, more profits, more results, testimonies from wherever we are connected to this call from. Once again, it is JIGSIMUR night class. Tell the people who you are going to invite that this meeting lasts until midnight. All right. It's going to be a 3 hours meeting every week. And we're going to be having different sessions. Tonight is product application, JIGSIMUR application. Next week, we're going to be talking about how to make money by helping the sick, how to make money by helping the sick. All right. So thank you so much, everybody. I pray that the Lord will make us to meet again in peace and not in pieces. Same time next week for night class. We are having some other session apart from night class. We may send you invite for all these classes, all these meetings too. But same time next week, we're going to be having our night class, and I hope to see you there. JIGSIMUR.
It works and it pays.
JIGSIMUR.
The ultimate.
JIGSIMUR.
It works and it pays.
Testify.
JIGSIMUR.
Too much money.
Too much money.
And JIGSIMUR.
Everywhere
you go.
Thank you. God bless you all.
Thank you very much.
Thank you.
Enjoy this beautiful program. Thank you very much.
Vera himself.
What I do is you give it.
We are using the same link next week.
Yes, same time next week.
The same link and same password.
Same link, same meeting ID, same passcode, same time next Wednesday.
Okay, thank you. Thank you. Well done, sir.
Thank you very much.
Have a
God
good
bless
night.
you. Bye.